Little bit of numbing medicine, and good afternoon. It's January 4th, 2024. Dr. Deuk Majan. Our patient here has injured his back, and he's got two bad discs, 3-4 and 4-5. He's got annular tears, and he has pain originating from those two discs. Shot. We're going to be fixing them today. Again, that's 3-4 and 4-5. That looks pretty good. I'm going to give some numbing medicine. Shot. I'd like to try to keep the numbing medicine away from the nerves, because it can actually make the nerves numb. And we don't like that. Shot. And what I mean by nerves, I mean nerve roots. Shot. Well, he seems to be comfortable. Are we in agreement? That's 4-5. Shot. Yeah. Shot. Right on the facet. So I need to get around that facet. But let's just take a look at that MRI. Yep. That bottom disc, you can see it. Jordan, show us the bottom disc. Correct. Shot. We want to go to the disc above that. Shot. He's got some wide facets. So, shot. Shot. First step is always getting into the disc that we have to fix, getting in safely. Shot. Shot. Let me see. Henry?
Yes, sir.
Why don't you show our audience why do disc herniations cause so much pain? Welcome back. We are still trying to get into the 4-5 disc. It's the hardest one to get into in his case. Shot, but we're working on it. Let's get a shot. AP. Seem to be getting caught up at the facet. Quick shot. Come on, Jordan. Now I'm too medial. All right. And he does have an anomaly of his bones. He's got some spina bifida occulta. You guys see that? Jordan, show the... well, maybe the next one. You can actually see... Oh, that's better. Shot? Maybe? Man, I can't get around this facet. Shot. Shot. Interesting. Here we go. I think we finally are making some progress. Yes. Yes. All right. And I was saying earlier on the AP view, shot. Let's go back to an AP view. He's got very short pedicles at L5. He's got spina bifida occulta at L5. All right. Show us the spina bifida occulta. Down a little bit. Right. To the right a little bit. A little bit more. Right there. Down a little bit. You guys see that down a little bit? You see that little white notch right there where the arrow is? That means that those bones never form together properly. You've almost got a hemilamina at the top. So this is a birth abnormality, not uncommon. It's called spina bifida occulta. It just means the lamina never fused together in midline properly. That said, we're making some progress. Finally, shot is maybe a little bit higher than I want to be. Shot. Shot. It's a little better. Shot. Keeps pushing it back. That's interesting. Shot. AP. Okay. Let's show our video, Henry, on how the Deuk laser disc repair actually works. All right, welcome back. So you can see from our video that the Deuk laser disc repair surgery we're about to do repairs the tear in the back of the disc as well as removes the herniation that causes the back pain and leg symptoms. Jordan, will you show our audience on the lateral view the facet joint that's huge and abnormal? Right there. Yep. Now take a look at the one above. Nope, down lower. Down, yeah, a little lower. Right there. Circle that. Look how tiny that is. Well, just look at yeah. Yes, there. Compared to the one below. Huge. Huge. Now look at the pedicle of 4 from right there to the right. There. That's the pedicle, that line, that dark gray line. Look how long it is. That's normal. Now look at the one below. It's from there to there. It's tiny. It's a very short pedicle. Short pedicles mean narrow foramens. Just makes the surgery harder. But we're going to get it done nonetheless. Our patient is nice and sleepy, right? Now he was a bit agitated earlier, and we had to put him a little bit more comfortable because he was moving around everywhere. And we can't get the surgery done when the patient's moving around. You're funny. Dr. Berndes says the bed is narrow, but it's a nice way of saying the patient is overweight, right? If you're big, then the bed becomes smaller. AP, So our patient is a big guy, and the bed is narrow. But the bed is the normal bed. We're not using a smaller bed. We're using the normal bed. It's just some people are a little bit bigger. Oh yeah, no, you did everything right. Dr. B did everything right. He made him sleepy. So it actually makes our job easier. Shot. AP. So I'm checking my front back views, I'm checking my side to side views to make sure we are navigating the needle through the right area. I don't want any problems. Perfect. But I will tell you this, his spine is really far forward. I'm going to show you what I mean. Take a look at this needle. It is sunk beyond the length of the needle. It is like literally 5 millimeters pushed in. And that's because he's got a very anterior spine. There's the tear. Perfect. Hold on, yeah, perfect. So we're gonna place the needle back into L4-5. Shot. You can currently see the guide wire. We're gonna bring the needle down. Shot. And now that I'm back in the disc with the needle at L4-5, the bottom disc, I'm gonna remove this guide wire. Shot. There we go. Shot. Perfect. And here we go. We're going to do our discogram. So why do we do a discogram if the patient's asleep? The answer, shot, simple. Look at the tear. Show us the tear, Jordan. That's a huge tear. That's where all of his back pain is coming from, that little tear right from there to, keep going, from there to, no, go lateral, outside. From there to, keep going, there. That little curve of black is the annular tear where all of his pain is coming from. We've lost now about, 10 drops of blood. So that's half a cc, half of a milliliter. Luis? All right, so we're going to start with, 3, 4? Let's go. Let's see here. Shot. I've placed the guide wire back at 3, 4. I'm removing the needle. We're going to place the dilator through his soft tissues, aka shot, fat, muscle, fascia. And the dilator is not damaging, it's actually spreading. I'm not doing that again. It's actually spreading. Shot. Okay. All right. Yeah. All right. Do you want me to wait? Yeah. Okay. So we're going to put our patient a little bit more asleep. I'm going to remove, in the meantime, shot the needle at 4-5. No. Henry, we have showed both videos, right?
Correct.
Shot. No problem. Any questions?
No current questions.
All right.
You're okay.
Shot.
You're okay. Stay still for me.
Shot.
Okay, try to stay still so we can finish up the surgery, okay?
Shot.
Okay.
Good. Dilator's in. We're inside the disc. We've now gone through the tear. That's painful. That's why he doesn't like it. He's moving around because we're literally right where his pain's coming from, which is the posterior annular tear on the left side. Shot. Now we're putting our tube down over the dilator so I can do the surgery. We call this a tubular retractor. Shot? Looks good, beautiful. You can see from the picture the tubular retractor has gone through the tear and it's sitting inside his disc. We're going to go in there and remove the what's called the interposed herniation, as well as the debridement of the annular tear. This will eliminate the back pain that he has from this disc. Dude, you're doing an amazing job. Please, don't apologize. I know you're doing a great job. You don't have to apologize. She has to apologize for not turning the laser on. I'm not getting anything. Is John here? Huh? I'm going to hit it. You guys ready for me to hit it?
Oh, wait. So that's the issue.
What?
It was not there once, put it there. It was ready, but
That's fine. That's fine. As long as it's not broken, I'm happy.
No. This is T10. This
Sure.
is T10.
Thank you. T10. This is the new one.
Yep, T10.
Yay. All right. For those of you die-hard Deuk Spine fans, this is our newest laser addition to our family. We call it number 10. And it's T10. No, Texas 10.
Exactly.
As opposed to Tennessee 10, but
Oh.
Texas 10.
You want in time?
No.
Oh, okay.
T10 is fine.
Okay.
As a matter of fact, there'll probably be a T10 soon. A real, Terminator 10. So this is T10. And with the way we name our lasers, we say where it came from, which is Texas in this case, because it's used. And 10 is the number we have. So it's our 10th laser from Texas. Not from Texas 10 lasers, but it's from Texas. All right, any questions, Henry Sanjay?
No current questions.
All right. Well, if you want to get up and walk around a little bit, Henry, to make your back feel better, you're welcome to.
I wouldn't mind that at all. Thank you so much. Sanjay's right next to me. He can take over for the next few minutes.
Thanks. All right, grab her. For those of you who've not met Sanjay, Sanjay is our AI expert, and we are in the process of developing a new AI platform for people that have back and neck pain. And the platform is going to be interface with the user through a chatbot, a digital human chatbot that will look like, talk like, act like a real human. And this chatbot will be available on our website and in our app eventually. And the chatbot will be able to speak 23 or eventually 60 languages, dialects. But when we launch it, it'll be around 23, right, Sanjay?
Yes, Dr. Deuk.
And the chatbot will be able to converse with you in Chinese, Spanish, in Hindi, English, Irish, just kidding, any language. And of course, we're going to restrict the dialogue of the chatbot. The chatbot is going to do something that other chatbots don't do. It's going to be able to answer your questions, not just with a text to voice, but also with
Multimedia.
multimedia. There you go. Thank you, Sanjay. And that's all Sanjay and my baby. That's what we're working on.
Very true.
It doesn't currently exist. That's because chatbots today only answer questions with text or voice to text to voice, I mean. And they don't use multimedia answers. And I've wanted to build a chatbot for years that does multimedia. In other words, instead of saying, well, an annular tear gets a herniation and gets inflammation, our chatbot is going to tell you that while they're bringing up a video animation that we're creating right now that will show you how a herniated disc gets inflammation and how that inflammation causes back pain. So rather than just telling you about it, we're going to be able to show it to you. So it's going to be an incredible chatbot, and honestly, I'm surprised no one else has ever done it because it just seems so logical to me. So that should be launched by December or earlier. We're actually in the process of working with a vendor, a third party who's going to be working with us to implement this digital human, virtual human. And Sanjay and I are going to continue to work on the platform, questions and answers, and then we'll probably launch it, I would say probably by October, December, right Sanjay?
Yes, Dr. Duke.
Now for those of you who don't know Sanjay very well, you might think he's a very serious kind of guy. And he is. But he's very smart, and he's actually got a sense of humor. And he just laughed, I think, for the first time ever online. Right there. Right, Sanjay?
No, I've laughed before.
All right, here's the tear. You guys see the tear right there?
Yes, we do. We can
And
see that.
Yep. And that's where his pain is coming from. That's the injury. By the way, his injury happened just under a year ago, about 10 months ago. And this right here to me, this disc with this endoscopic view, it looks like a disc that was injured 10 months ago. There's not a whole lot of scar tissue. So younger disc injuries within a year of injury, they typically don't have a lot of scar tissue. His does not have a lot of scar tissue. He has more herniation. He still has some scar tissue because you're going to get scar tissue after a few weeks of inflammation. And he's had this for about 10 months. And I can tell you right now that this injury looks very consistent with 10 months old injury of the disc. So that makes me feel good knowing that the patient's story, his history is consistent with what I'm seeing inside the disc. Now, there's no test in the world that tells you exactly when a herniated disc happens, but this endoscopic view you're seeing right now is the most sensitive of all tests. There's nothing more sensitive. I have used every modality known to man and women to assess disc injuries. MRI, CAT scan, X-ray, CT discogram, you name it, PET scans, all the different MRI modalities. None of them will tell you how old a disc injury is, except for this endoscopic view. It is the most sensitive. And what I'm seeing here is very consistent that this disc injury happened about a year ago, just under a year ago. Makes sense. Okay? That's important, by the way, because there's medical legal ramifications. What that means is sometimes there's questions about whether a patient's injuries are related to an accident, like a car accident or a slip and fall, or even a work accident. And it's my opinion in this case that this disc injury is related to a work injury that this patient had 10 months ago. Everything I'm seeing in here is consistent with that injury. Now let's pretend for a moment the injury was much older than a year ago. Then I would see a lot more scar tissue, a lot more calcium, and it would be a lot thicker. We're seeing a lot of herniation though, and it's very consistent with his story of his injury. All right, just about done. I got about 3 minutes on this disc, and then we're going to move on to the next one. But so far, his surgery is going really well. I'm very pleased. Any questions?
We have a question from Kelly James on YouTube.
Sure.
Is that the disc, the white stuff that I see?
Yes. Yes, so what you're seeing, Kelly James, is the blue stuff is the herniation, and the white stuff is the annulus fibrosus that's torn. And you can see right there, you see the blue stuff? That's stuck inside the white stuff, which is the annulus. So there was a tear way down here, and the blue stuff, the nucleus squeezed, and it made it this far. And now it's just causing horrible pain for the patient. So I'm going in there and cleaning all this stuff out. And that's going to allow the annulus to heal naturally and without any pain. This surgery is amazing. I've never seen it not work. Never. In 17 years, going on 18 years, it has worked every single time. And if you look at the numbers, our cure rate for back pain from the disc is 99.6%. 99.6. That doesn't mean it cures all back pain. It means it cures back pain from the disc herniation. Here's another piece of herniation right here that I'm working on. See that? And there's an annular fiber. You see that right there? That's annulus fibrosus. And you can see the blue stuff is here. It shouldn't be here. It should be way down there. And it wouldn't be blue, by the way. It would be white. So the fact that it's here, so far out of place, means it's a herniation. All right, look at that annular tear. That's a beauty. That thing is only maybe 2 millimeters wide. So that's going to heal really quick, but we're pretty much done. Okay? So that's a really nice annular tear, Sanjay, if you want to keep that picture for a post-Deuk laser disc repair. Annular
Yes.
tear right there. Let me see if I can stop the irrigation. That just made it worse. Can you get a picture of that right there, Sanjay?
Yes, I can do that.
Right there. That's a picture I'd like you to save and send. So this is after Deuk laser disc repair, the tear, how big it is. It's only about 1 millimeter wide. Now, some people it's 2 millimeters, some people it's 3. But because his tear is so new, and it wasn't huge to begin with, it's almost completely closed already. Whoa, 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 whoa. Yeah, I got it. Whoa, 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 whoa. Scoop off, please. All right, let's get the lights on. We're going to do some irrigation. We're done with this disc. We've got one more to go. Any more questions?
No questions?
All right, you watch this. Don't let it come out as I pull this out. It's good. Okay, we're going to put a little pressure on the muscles because we don't want it oozing. It's always good to keep any kind of blood from getting into the muscle because when it breaks down over the next few months, it causes muscle spasms and muscle pain. And then patients freak out and they call me and go, I'm having pain. You're having pain because there's blood in your muscle from the surgery and it's going away, but just be patient. The longest I ever had muscle spasms from the surgery, from the blood, was 3 months. I had one patient for 3 months. He was a performer on a cruise ship. He was the piano man, singer, performer, and he was freaking out because he's like, I'm still having back pain. Yeah, but it's not the same. Some num-num. Anyway, I'm just telling you, it goes away, but you gotta wait. So I try not to get blood in the muscle I try to put pressure and keep it out of being in the muscle, but sometimes you can't help it. I'm giving the patient some numbing medicine. That just helps with things, but he's beautiful. Shot. Can see the tip of the dilator approaching the foramen at L4-5. Now we're calling this L4-5 shot. Some doctors would call it L5S1. The discrepancy in the nomenclature or naming has to do with the fact that this patient has a really weird disc at 5-1. Show us the weird 5-1 disc. That's not normal. You guys see that down there? That's a disc. We're calling that one 5-1, which means the one above is 4-5. So some doctors would call the one we're at right now 5-1. Other doctors would do it our way, which is 4-5. In the end, it doesn't matter as long as you operate on the right disc and fix the right disc. Okay? Shot. Bigger tear on this one. Bigger tear. Bigger tear. I could feel it. It went in a lot easier. It's a bigger tear. So he's got a bigger annular tear at this 4-5. Okay, almost done. Shot. That looks pretty darn good. I think, Luis, we're good. Uh-huh. Okay, any questions?
No current questions. I'm back, by the way.
Oh, wonderful.
I've been back for a little bit.
So we've got just this last one to do. All right, we are now at the next disc. Yeah, this disc looks different, doesn't it? It looks to me like it's worse than the last one. And I can actually feel more scar tissue here. So interesting, his history was that he's had, you know, a long time ago he had some back pain, and I think it was coming from this 4-5 disc. But definitely the newer pain is probably coming from 3-4 and 4-5. But yeah, see this right here, folks? This is an older injury than a year. This is definitely older than a year. Right here. A lot of scar tissue. Oh yeah. This is like probably 20 years old or longer. More than 10. Right here. Now, I'm going to tell you a secret. Some patients can actually have an old injury and then get a new injury on top of the old injury. And I think that's what we're dealing with here. So I think this is the old part of the injury you're seeing. Look at all that. Very different than the last disc, right? Probably 8 minutes left, maybe, doctor. Everything okay? You need C batteries? What do you got there, huh? Normally when people ask for C batteries. Right? A Christmas toy. I love it. All right. Just about done. I got less than 5 minutes. Wow, this is definitely, some of this is older than, much older than 10 months. Some of this is probably 3, 4, 5 years, maybe, 10 years old. Like this area right here, 10 years. Doctor, we got about 3 minutes left.
You got it? There you go. Thank you so much.
What fell? Anybody let Davis know we're going to be ready for him in about 45 minutes to an hour? 45 minutes probably. All right, questions, Henry?
No current questions, but we do have a comment from Kelly once more on YouTube.
Sure.
Just saying, amazing.
Yeah, thank you, Kelly. It is pretty cool. You know, you get to watch live spine surgery, and you get to ask questions, and you get to watch the most advanced spine surgery in the world, all at the same time. This surgery you're watching will be the only surgery done in the future for a herniated disc. There will no longer be microdiscectomy. There will no longer be laminectomy. There will no longer be fusions. There will no longer be artificial discs. And the problem is the companies that sell all those cages and screws and rods, well, they don't want to see those invasive surgeries go away. So they're fighting our technology every day, preventing people from learning about it, because they don't want you to know about this. They don't want you to get it. They're fighting it, and we're fighting them. And it's a battle, and we're just a small little company trying to help people, and they're big companies trying to prey on people. It's sad that they're trying to keep people from having this less invasive surgery, because it doesn't have any metal or cages or bone graft, and they all make their billions of dollars a year selling those parts to be put into patients' spines that you don't need. And we're fighting them to get them to back off and to do what's right for the patients. But we're up against everybody, basically. There's so many people making billions of dollars on doing invasive spine surgery. We have 1 minute left, I think, here. Scope use, I would give it a, yeah, he doesn't like that. I would give the scope use a 6. 8.5. Thought it was going to be worse than that. Any more questions, Han?
Yes, we have a question from Mohammed on YouTube.
Hello, Mohammed. Welcome to our live stream.
They ask, what do you think of Dr. Raheem Gonstead Christopher in the USA?
Great question. What do I think of Dr. Raheem Gonstead Christopher in the USA? The answer is I don't know who that doctor is, so I can't really tell you anything. I'm sorry. All right, that's the end of the disc right there. Can see the fat in the epidural space. He is not liking this because this is a painful part of his disc, which we're fixing. All right, you guys see the fat there at the top?
Yes, we do.
30 seconds. Here you go. That's it. Epidural fat. There's the disc. Now look at that. There's another one where the tear is so small. You guys see that? It's going to heal really quick. That's another nice tear right there. Can you get that, Henry? Snap, snap.
Not a problem.
And send those, because these are annular tear after DLDR. Annular tear after DLDR. And it's really nice. Very
Copy
small.
that. Not a problem.
Thanks. Scope off. Good job, everybody. We've got one more surgery today. It'll be a quickie. Our patient comes from New York. He is a returning patient. He was here a month ago and had his discs fixed along with his facet joints on the right of his lower back. Now he has left facet pain and piriformis pain. I need the dilator. And he has sacroiliac joint pain. So he's got, out of the 30 causes of back pain, he has 15. I was counting them yesterday. I mean, we don't see a lot of people with 15 causes of back pain. The average is around 4. He has 15. I was telling him, but he's had problems for, 30 years, 40 years with his back, and the doctors never fixed him in New York, so he came here and we figured out what's wrong, and we're going to fix him in 2 trips. By the way, his wife also had our DPR for the knee, Deuk plasma rhizotomy, and her knee pain is gone. She no longer has any knee pain. She's so happy. She was supposed to get a knee replacement done in New York. They wanted to replace her knee with an artificial knee. We told her, before you do that, let us try our DPR. She did, and lo and behold, her knee pain is gone. So, all right. Putting some staples. Go ahead. Put that, oh, you want to put, yeah. Just still do a little pressure. Folks, great case, went very well for this patient. He was a bit of an anesthesia challenge. He was moving around a bit because he was a bit agitated. We gave him some ketamine, settled him down. Dr. Berndes did an amazing job. And my team did an amazing job. So I think he's going to be very happy with his results. Maybe he'll even do a testimonial tomorrow, and we can show you guys that in a few weeks. All right, Henry. I'll come answer questions.
Copy that.
Blood loss, I'm going to call 2 mil. If you want to do a quick testimonial, I'll be there shortly.
Copy that.
We're here at the Deuk Spine Institute. I have a patient who traveled from Ohio to Deuk Spine Institute for his lower back. And he's been through a lot of treatments in the past that didn't really work. They may have given him some temporary results. I'll let him tell you more about that. But he's here today, a new man, just 24 hours after his outpatient surgery. He had the Deuk laser disc repair. You can see in the video we made some small cuts on his back, went in through a natural opening in the spine called the neuroforamen. We didn't do any damage under the skin, and we were able to repair the herniations that have been plaguing him now for years. How long have you had problems with your back?
Since approximately 2009, quite a while.
All right, so about, what, 14 years now?
Yeah.
And you've had surgery before. How were those other surgeries?
I had 2 minor surgeries. One lasted for about, relieved my pains for 3 years. Second one, maybe 6 or 7, somewhat of the pain, enough to get me through. Over the last couple of years, the loss of balance, which really affected my job, was just getting worse and worse and worse. I really didn't know what to do. And I went through 3 local surgeons, and everybody, the only answer was fusion, fusion, fusion. That was pretty much going to end my career. So
Yeah.
I found this guy.
And you had surgery yesterday. How are you feeling today?
Just a little bit of soreness in my back. The balance is back. I know I'm on a way to recovery.
You look a little teared up there. Yeah? It's been a journey, hasn't it?
As soon as I did the video conference with you, sort of broke down like this too. Just hoping
I understand.
they'd be back.
So can you tell the difference at this point, now that you've had the surgery?
Oh yeah.
Yeah?
Yeah.
You said you got up and you walked straight this
That's,
morning.
I haven't been able to do that for over a year without falling. I couldn't walk down a hallway without
Yeah.
grabbing the walls.
And the reason for that, your nerves were getting pinched pretty bad. And we went in there and unpinched them during your surgery with the laser. And we did not have to do a fusion, and you're not going to need a fusion. That's the great news.
Yes, it is.
And is there anything else you want to tell your fans out there?
I just hope more people that these doctors are only giving them that option, fusion. Come see this guy and don't ruin your life.
When do you head back?
Sunday.
Sunday. You gonna enjoy Orlando for a little
I'm
longer?
gonna try. Yep.
Yeah. All right. We'll try to make it out to the Space Coast and go see the rockets over at the Kennedy Space Center. It's pretty cool over there.
Okay.
All right, sir.
Thank you, sir.
You're welcome. My pleasure. Let's get you guys out of here. Come on.
I've been told by so many different doctors in so many different countries that either there's nothing they could do for me or that this is just my life now and I have to get used to it. You know, like, so when you came along and told me, like, oh, you don't have to live like this, it's like, well, everyone else says I do. So, like, I really didn't believe it. I was like, there's no way. Like, I've been told now for 5-6 years, like, this is it. You're never gonna play sports again. You're never gonna not be in pain again. Like, this is what you have to get used to. And so when I met you and when you were telling me, like, no, you don't have to do that, I was like, it's too good to be true.
Yeah.
There's no way. And then I woke up from the surgery yesterday and I wake up this morning and I just haven't stopped smiling because you were right. Everyone else was wrong.
Of course.
I feel great.
I'm Dr. Deuk, and it's June 28, 2023. I'm here with one of my lovely patients who traveled from Texas. She has been, as you've heard, suffering with back pain for a long time, years. You were telling me that you've traveled, talked to surgeons around the world, doctors around the world, and they've all told you you have to live with it.
Yeah.
That's your life. The truth is that used to be the way back pain was, but not anymore. Deuk Spine Institute has made a breakthrough discovery on not just how to cure back pain, but the causes of back pain. And because we now understand the exact source of back pain in every patient, we're able to treat that specific source. For you, you had the Deuk laser disc repair. You had 2 discs fixed yesterday. Before you came here, what was life like for you?
90% of my day is in bed, laying down. Pain for 5 years, pretty constant. Not doing any of the stuff that like made me me. Like no sports, no going out for dinners anymore because I couldn't sit for more than 5 minutes. Like I can't believe I'm sitting right now. Like it wasn't really much of how I wanted to live my life at all.
And it's not just you, but you're married, right?
Oh, my poor husband. I didn't take the trash out since 2018, which was like the one like nice thing, because I didn't have to take out the trash. But he had to do like everything for me. So it wasn't even just my life, and that was what was harder. Like he had to completely change his life. We used to travel, we used to play sports, we used to do stuff together. And I got to sometimes watch movies with him if I could sit up to watch a movie, or he'd have to like get a weird angle so we could lay down and watch a movie on the ceiling together. He's an absolute trooper. He stayed with me like through all of it, never complained. But you know, like that's not what you want for your partner. That's what you don't want that for their life.
And can you imagine when he heard the news from these other doctors telling you have to live your life like this for the rest of your life? Can you imagine how he felt? And he stuck around.
Yeah. No, I mean, like, I feel so lucky that I had a partner who was prepared to do that, but that only made me feel worse that I was making my partner do that, you know? Like, it's one thing for yourself to be going through the pain, but it's another thing to see how your pain really impacts all of those people around you. Like, my little brothers who used to see me as kind of this tough, can do anything for them, older sister, were taking care of me and carrying, like, my bags if I needed anything and had to pick stuff up for me. Like, my dad just every day worrying about me, and I was always the tough kid, like never had to worry about me at all. So it's just such a weird, uncomfortable, terrible paradigm shift.
Sitting here today, less than 24 hours after your Deuk laser disc repair, how much of that pain do you have?
None of it. I have none of it. I can't believe I had surgery yesterday. Like I just feel better than I ever thought I could feel again. Like I never thought in my life I'd get back to this point, so.
And this point being?
No pain. I don't have any pain. I can sit and my left leg hasn't gone numb on me. I can smile and have a conversation without the pain in the back of my head making me want to just lay down and not do anything. It's crazy.
And what would you say to the people out there living with back and leg pain?
You don't have to. Just call Dr. Deuk. Even if you're skeptical like I was, like call him, see what he has to say, explore the option, and just give yourself the gift of your life back.
Totally agree. One question, are you feeling this way because we've given you powerful narcotic painkillers?
No, I'm not on anything. I actually didn't even take the Tylenol extra strength. I 100% nothing. I had water and a little bit of coffee this morning. That's it.
And this is part of what's revolutionary with our technique at Deuk Spine Institute is curing pain in the back and neck, no hospitalization, outpatient. You went home an hour after your surgery.
Yeah.
and no painkillers afterwards, because we're not doing trauma to your body during the surgery. The reason patients need pain medicine after surgery is because the surgeon is hurting their body with the surgery. Do you have any pain after the laser surgery?
None. I wasn't anticipating this at all. I have none. I feel fine. I don't feel fine. I feel great. It's really surreal still.
And you can see during your surgery, we made a tiny little 7mm incision, tiny, 1/4 inch. And we did the whole surgery on those 2 discs with the laser, cleaning up. There was a lot of scar tissue at L5-S1, and there was not as much scar tissue, but you had a small tear at 4-5, and we were able to clean those tears up with the laser and get rid of your back pain. Congratulations.
Thank you.
Is there anything you want to say to your fans out there and your family?
Oh, man. I can't wait to do stuff with all of them again. I can't wait to like go on trips and carry my own suitcase and hike and play sports. Not for 1 year,
Not
I
too
know.
soon.
Not too soon. No, it's all in the future. But just knowing that it is in my future again is like, it actually is life changing. So thank you.
You're welcome. Congratulations.
Thank you.
You're welcome. All right, let's get you guys out of here. When do you head back?
I'm here with a patient of mine who traveled all the way from South Carolina to come to the Deuk Spine Institute. She's a healthcare provider herself. She's had some back issues. She had the Deuk laser disc repair yesterday, and she wants to share some of her experience with you. Tell us about your back pain and your leg pain before your surgery yesterday.
I had surgery on L4-L5, L5-S1, so my symptoms were classic. I had the sciatic pain that ran down my leg. Every once in a while my foot would go numb if it was pretty irritated. And then I had pain along the top side of my hip. So pretty normal type stuff. I was going to the chiropractor, I was getting massage therapy, I was starting on meds once I did imaging and made sure that this was actually a herniation and not just like a muscle pull or something. So I had kind of gone through all the things. Had back surgery in 2020 at another institute, and they did a microdiscectomy / laminectomy of L4-L5. I was good for maybe 2 years, almost 2.5. Before it re-herniated. So not the most fun in the world, because you expect whenever you go to have a procedure that it's fixed and your life will be ongoingly better. But I'm a nurse and I ride horses, so I'm pretty mobile all the time, and that kind of pain just really gets you down.
So why did you travel from South Carolina to Deuk Spine? What do we offer here that you couldn't find there?
I was on the great internet search, to find out more information. So to read more about spine surgeries, about how many times people relapse, like all what's involved. I surely didn't want to go up to a fusion because that's absolutely ridiculous. So I happened to find one of your videos on YouTube. You offered the laser therapy. I was just sold like almost as soon as I saw it, because it made sense to me.
Yeah, having the perspective of being a nurse and a healthcare provider, it makes sense. You're fixing the problem, debriding the disc tear, allowing it to heal naturally into a pain-free state. You had your surgery just yesterday.
Just yesterday.
Not even 24 hours ago. Were you in the hospital for your surgery?
I was here in your surgery site. I got here around 1 o'clock-ish. Did all my pre-op stuff. Rolled in probably around 1:35. I think our procedure lasted not quite an hour. I was out and eating dinner with my dad at 5 o'clock at a restaurant that your anesthesiologist recommended.
Oh, good.
Dr. B, he's great.
So no hospitalization.
No.
No morphine pump after surgery because you're in so much pain from
Not
the
at all.
surgery. No narcotic painkillers after surgery, right?
No.
What did you take for pain that we gave you? What new medicine did you take after surgery?
So I haven't taken any new medicine after surgery. I was on Robaxin and gabapentin prior to. Of course, I have to wean off gabapentin, so I did take my gabapentin this morning, but I didn't wake up in any pain. But unfortunately, that med you have to wean off of, so it's not like I can stop it to cold turkey.
Yeah, so basically we did a small incision. We went in with the laser and debrided your tear. And at the end, we had a tiny 7-8mm incision. And there's really no pain after the surgery, so there's no need for narcotics. After your prior microdiscectomy, you probably needed to take some Percocets
that
or
was,
oxycodone.
just to roll out of bed, just to get up off the couch after that surgery.
It's painful.
It's painful.
Yeah.
It's absolutely painful.
And the difference, people ask me, what's the difference between Deuk laser disc repair and a microdiscectomy? The difference is a microdiscectomy goes straight into your spine. The surgeon has to pull all the muscles off your spine. Then they have to drill a hole in the bone to get to the disc. And they have to remove ligaments, and they have to take your facet joint partially out. There's so much destruction that goes on under the skin. The surgeons don't talk to the patients about it because
No, they didn't.
everybody does it. They think there's no better way, but there is a better way. It was developed by an Iranian orthopedic surgeon to come from the side. And I'm a student of one of his students, so second generation endoscopic surgeon, transforaminal. And it's a better surgery because it doesn't cause any damage to your spine or your body. It's wonderful.
It is wonderful, I'd have to say.
And how do you feel today? Is your preoperative pain gone?
Oh yes, all of that's gone. The only thing that I feel is like right in mid-spine where you basically stab me. And that's, you know.
Yeah, you know about that. You watched the videos. So,
Brought
yeah.
a tear to my eye there for one little second.
I see.
I forgive you.
Thank you. Thank you. Well, I'm glad you're doing well. Is there anything you want to say to your fans and friends out there? Because we know you have friends. I did some shout outs.
Oh yeah, you did do some shout outs to my nurse friends, which I appreciate. You know, and my husband has just been wonderful through all of this. He just wants me pain free and I love him for it. So
That's
he
awesome.
was a major contributor.
What's
even
his
though
name?
Ted, even though he's not here with me,
Hi,
he's
Ted.
here
Thanks
in
for being so
spirit.
supportive. Yeah, you're lucky you have a supportive family. You know,
Absolutely.
it's hard for people to do this alone.
Yeah.
Right?
Yeah, my dad drove me down, so he's been here with me because he can, you know, he's retired, so he can come down. And then my husband, you know, we have a farm, so he stayed to take care of the animals.
Well, congratulations.
Thank you so much. I
Safe
appreciate
travels.
you.
You're welcome.
Yeah.
All right. And good morning, I'm Dr. Deuk Majan here at the Deuk Spine Institute with a patient who's traveled 10 minutes from Merritt Island, is that correct?
I'm in Vieira.
Oh, Vieira, just down the street. Okay, local. You just had the Deuk laser disc repair on your lower back yesterday for a herniated disc at L3-L5. It was a foraminal herniation, and it's one that is tough for doctors to find and discover. But we saw it at Deuk Spine, and you were having horrible back and right leg pain. That was yesterday before your surgery. Here you are less than 24 hours later. How do you feel?
Wonderful. Walking straight. I feel no leg pain, no back pain, just a little sore, but that's about it.
How long have you had the back and leg pain for?
Since 2012, 2013, since my surgeries.
You live with pain.
Right.
He had, I guess, a microdiscectomy done.
Correct.
Did that fix him?
No, a month later he was back in surgery.
What kind of surgery did you have done?
The fusion, S1-L5.
So you had an L5-S1 fusion, good. Did that fix your problem?
No, not at all.
And their suggestion was take the metal out, and that they already seen that he had a problem with the disc above that one, so let's take the metal out first, then within a year go back and do another fusion on the disc above that.
And that was the metal they put in you?
Yes, sir.
So they put metal in you for the fusion, and then they told you afterwards, well, we got to get it out because that's what's causing your pain.
Right.
Kind of silly, isn't it?
Yes, sir.
All right, glad I'm not the only one that thinks that's a bit silly, but that's right, it is silly. And it's not just the surgery, the fusion. Didn't you have pain management and stuff in between?
Yeah, so I had shots and a nerve specialist do some stretchings and hands-on stuff, but that's about it.
So you had shots, you had therapy, and then you had surgery, and you had more shots and therapy. And that's the problem is you're like I think about it as like a washing machine
Yeah.
going around, and they're just washing the money out of your pockets and washing your life away because your quality of life has not been good, has it?
No, not at all.
How did you find Deuk Spine Institute?
My wife.
I couldn't believe it, amazing. Last time he had surgery, 9 days he couldn't even hardly move. And I mean, he was up last night pacing the floors, antsy, trying to find something to do.
This must cost your family a lot of money dealing with the pain. Over
Oh
all
yeah,
these
well,
years.
and it cost him not just, you know, with the pain, he was not able to do the stuff he likes, fishing, throwing the baseball with our son. So just the, you know, just doing life things he's not able to do that because of all the pain that he goes through. So now we're just so grateful that we found you guys because, I mean, I have not seen him walk like this in 19 years.
And that's just one night.
Yeah, that's just one night.
And
so
no pain meds.
no pain meds, no anything, no medicine. He had took no medication whatsoever last night.
So just to recap, your husband, like millions of people, had back pain. He went and had microdiscectomy, which is a procedure where the surgeon basically ruins the back of the spine in order to get to the disc. That caused instability, which then he needed a fusion done shortly afterwards, right?
Yes.
You said a month later?
Yes, a month later.
And then you went back again because he was still in pain and worse after the fusion.
Right.
And they told you he needed another surgery, a third one,
Correct.
to get the metal out.
Right.
And then he was going to come back for another fusion after that.
Correct.
And then there would be more fusions and more fusions, right?
That's never ending.
Never ending. And we see this all the time with people that have open back surgery, invasive back surgery, is a cycle of over. Well, I'm sorry to cut that experience short for you, but I've got to get the show on the road. We have just completed 2 discs repair with the laser. For those of you who've never seen this surgery before, this is called the lumbar spine. It's the lower back. And what you're not seeing here is the hip bones, kind of like the pelvic bones that come off the side here. So this is just the tailbone and then the lumbar vertebrae, and then you got discs, right? And so this patient has something he was born with that was abnormal, spina bifida occulta. Basically the 2 bone islands that grow together in the middle and form the spinous process at L5, they didn't fuse properly. So it's just a congenital defect, but it never causes any symptoms. And this patient had no problem from it. We just noticed it when we were doing the x-rays. Just wanted to mention it to you. Anyway, we came from the side with the tube, okay, and went through a hole that's already there. So there's no damage to the spine like all the other doctors do laminectomy, discectomy. They're ripping out parts of your spine. And our new website will go over that and show you. That's going to be launched in February. But for right now, suffice it to say, this surgery you just watched is the least invasive surgery in the world. And it's called transforaminal surgery. The problem is most surgeons can't do it because it's extremely difficult to do technically. You've got to have the right equipment, the right training. Most don't have it. So they just go through the old-fashioned, rip your spine apart, get down to the disc, and then muck things up even worse. We went from the side, went through the hole, got in here, and I used the laser to go in and clean everything out for 2 discs. It went perfect. The first disc we did definitely looked like it was a younger injury, something around a year ago when this patient had their accident. The other disc we did definitely was an older injury. That was the L4-5. Older injury, lots of scar tissue, lots of like chunks of hard stuff. That only happens with, years and years of inflammation. So I think that we know he had back pain for many, many years since he was young, and he's older now. So he probably injured L4-5 a long time ago. It tried to heal, maybe caused some pain, and then he got into an accident at work a year ago, herniated L3-4, and worsened L4-5. We went in and fixed both, so he should do great. There were no complications. Surgery went really well for him. The only thing we had difficulty with was he was just a bit agitated, moving around, so we had to settle him down with a little ketamine, but it worked perfectly. All right, questions?
Questions? We have 2 so far. This first one comes from J Rock on YouTube.
J Rock, yes, I remember J Rock from 2023.
Yes.
Welcome back.
He asked, so what happens when you can't get on both sides of the disc, and after surgery, would you still have pain?
Well, J Rock, great question. First of all, thank you for asking. We can get on both sides of the disc. We don't need to go on both sides of the disc for everybody. What's quite interesting, to be honest with you, it's a great point. If you have a herniation at L4-5 and it's on both sides, but the patient only has leg symptoms on, say, the right side. Turns out, if you go on the right side, you clean out that tear, remove the herniation that's irritating the nerve, and it has nothing to do with the nerve root, by the way. You fix the leg pain, of course, but you also get rid of the back pain. Even if you don't go to the left side, if you just do the right side, you don't go to the left. And it's kind of interesting because if you think about it, most leg symptoms come from inflammation. So what that tells you
is that the tear on the right side is the symptomatic tear because it's creating inflammation that's getting on the nerve root causing right leg pain. So the patient's sidedness of their symptoms in their back is very important, and I look at that when I'm making my determination about what side to go. Now, if the patient has both legs bothering them, I go on both sides. So great question, but if your patient's only having right leg symptoms and right-sided back symptoms, I only fix the right side. It takes the pain away.
And last but not least, this comes from Roscoe on YouTube,
Roscoe.
asking what percentage of cases that are submitted to insurance get denied for the DLDR?
Huh? What percentage of cases that are submitted to insurance get denied for the DLDR? Probably 90 to 95% of the cases get denied. Very high denial rate. That doesn't mean that we don't pursue payment. Of course we do. Roscoe, just so you understand, insurance companies want to deny everything. So if you just let them get away with it, you're a fool. And I have to be careful saying that to a man whose name is Roscoe, because you might have a Roscoe. All right, I can assure you I have a bigger Roscoe, several of them. But so don't come looking for me. But to be honest with you, if you have a bully who steals your lunch money every day, are you just gonna keep coming to school every day and let them take your lunch money and beat you up? Or are you actually gonna stand up for yourself and do what's right? Insurance companies are supposed to pay for medically necessary care, and these surgeries are medically necessary. The only reason the insurance companies deny any kind of treatment is because they think they can get away with it. And as long as you let them get away with it, they will get away with it. The only reason a bully steals your lunch money every day and smacks you around is because they believe you will let them get away with it. The moment the bully realizes you are not going to let them get away with it and they're going to pay a price, they will stop bullying you. I know this because I was bullied as a kid, and I beat the shit out of the bullies, and they stopped bullying. Not just me, they stopped bullying everybody. So, I'm going to take lessons that I learned as a child, and I'm going to help you patients fight your insurance companies to get paid. So yes, about 90 to 95% of our surgeries we submit to insurance are denied. However, they are denied improperly. They are denied illegally. And we are getting ready to file our first class action lawsuit for our patients against insurance companies. And I expect to win. And I really think we're going to win. I don't see any reason why we wouldn't win. We are on the right. Okay? How much will we win? No idea. That's the real question. We're going to win, but how much is the judge going to make the insurance company pay for the surgery? Your guess is as good as mine. That's where it gets gray. Now, we have a lot of insurance companies that have paid for these surgeries over the years. We've done thousands of these surgeries now. And we have hundreds of payments by insurance companies. And they range from $45,000 to $185,000 or even $250,000. Okay? So the insurance companies do pay. I could show you their EOBs where they paid. It'd make it kind of interesting. I'm happy to do that. As a matter of fact, maybe you guys can remind me to get some EOBs and we'll show the EOBs for Roscoe. Point is, Roscoe, in life, you don't just get what you deserve, you get what you fight for. And patients have to fight for what's right. And we're there to help them do that. But we can't run our organization on charity because nobody gives us charity. Nobody. So we have to fight for the money we get so we can stay in business. Okay? Typically what happens is patients will pay cash, a small amount, we call it a deposit, and then we'll bill their insurance afterwards. If the insurance denies the claim, we'll fight them, we'll appeal it. on their behalf. We know how to do that. And then we'll take the insurance company to court on behalf of the patient. We have lawyers who do that, and we're getting ready to do this on a big scale. So sit tight and watch. And if you feel like actually being part of the solution rather than part of the problem, then get the surgery done and fight your insurance to get it paid for. Because the patients that pay for the surgery today get the surgery done, bill their insurance, the insurance doesn't pay, we fight the insurance, and we win. We are basically doing all the work for future generations of patients. This is how it's done in medicine. The insurance companies never agree to pay for new technology without a fight. I've never seen it. Artificial discs. When artificial discs came out back in 2002, the insurance companies denied artificial discs across the board. They wouldn't pay for them. And then people started paying out of pocket. They got the artificial disc put in. They did well. They fought their insurance company. They got their insurance company to pay. The court said pay. Okay, the science is there. We have the science. The insurance companies don't care. We have great results, the best results. The insurance companies don't care. All the insurance companies want is to not pay your bill. So if you're going to let them not pay your bill, then shame on you. But if you want to be part of the solution, then come over here, get your surgery done, and be part of the solution. Is that it?
Yeah, that's it for questions.
All right, thanks. We got one more to go.